Hello and welcome. This is Hangouts with HIVE. Our topic of discussion today is HIV prevention for women in the U.S. Where's my PrEP? My name is Yamini Oseguera-Bhatnagar, the Power Health Coordinator at HIVE, a hub for positive reproductive and sexual health, and I am participating in this Hangout live from San Francisco. I am joined by many wonderful colleagues. Caitlin Conyngham is the Director of PrEP Program at Philadelphia Fight. She's been working in a community health setting to provide PrEP to youth and marginalized communities since 2013 and is deeply committed to reducing barriers to PrEP access and care. Thanks for being with us, Caitlin. Nika Seidman is an obstetrician, gynecologist, and a fellow in family planning at University of California, San Francisco. Prior to fellowship, she was a clinician at HIVE and the National Perinatal HIV Hotline. Her research focuses on integration of HIV prevention and family planning services. Nika, thanks for being with us. Tess, Timoney, nurse midwife, is the Director of HIV Services for Women at Bronx, Lebanon Hospital Center. She has provided obstetric and gynecological care for positive women in the South Bronx since 2001. Thank you for being with us. Sammy Lubega is a faculty member at Bay Area North Coast AIDS Education and Training Center, a chief resident at UCSF Family Community Medicine Department, and has been working with several community-based clinics on implementing PrEP services in Oakland and the Greater East Bay. Thank you for joining us. Amanda Rodriguez is an analyst at UCSF. She's interested in HIV and women's health research. Thanks for being here, Amanda. And last, but certainly not least, Ms. Shannon Weber is the Director of HIVE and the founder of PleasePrepMe.org. She is passionate about creating a world where women have sex and babies when, where, and how they want to. Thank you for joining us. Welcome, everyone. For all of those watching, thank you for joining us. And just some quick housekeeping. We will broadcast for the next 1 hour. During this time, as you listen to our panelists, please think about questions that you may have for them and type them in the question and answer box on the bottom right corner of your screen. Also, feel free to leave us comments there as we roll through this Hangout. Please note that you'll need to sign in via Google Plus in order to do this. We will try to get to as many questions as possible. The purpose of this Hangout is for us to answer questions, but the ones that we don't get to, we will answer in the comments section of the YouTube page, and so that'll happen within the next day or two. We will also share out a lot of resources at the end of this Hangout and present links to those as well. Lastly, please feel free to join us on Twitter during this Hangout and during this broadcast and afterwards using the hashtag #Where'sMyPrep. To start off, a little bit about HIVE. HIVE was founded in 1989 and is the umbrella organization that encompasses clinical care, training, and advocacy, and a virtual hub for disseminating best practices for comprehensive HIV-informed reproductive and sexual health care. Our mission is advancing reproductive and sexual wellness for individuals, families, and communities affected by HIV in San Francisco and beyond. Our vision is to see a world where people affected by HIV have safe pregnancies, reproductive autonomy, access to state-of-the-art health care, and enjoyable sex lives. Why are we talking about PrEP for women? This is the question that we answer today. To answer these questions, let's start with the CDC estimate that 468,000 women in the United States have substantial risk for HIV acquisition, for whom PrEP and other effective prevention methods are indicated. Yet, the number of prescriptions to women for PrEP remains steadily low, indicating that our outreach and screening efforts are not including or reaching women in the ways that they should. It's important to note that very little is known about who comprises these 468,000 women for whom PrEP is indicated, but there was formative research conducted a few years ago by Dr. Judy Auerbach and her colleagues, which found a couple things. One, that only a few women had ever heard about PrEP before the focus group experience. Two, that many women were dismayed and in fact were pretty angry that they had not heard about PrEP before the focus group. Three, that a lot of women had mostly good relationships with their primary care doctors and OBGYNs and expressed willingness to turn to them for PrEP information and services. Four, that they had distinct ideas about how PrEP might affect their sex lives, including their use of condoms. And lastly, that they supported a range of PrEP delivery options, including pills and gels, injectables, and vaginal rings. There's more to this study, so go online and find that. Since we know so little about women who would benefit from PrEP, let's look at what we do know about women who are newly diagnosed and living with HIV, which might give us an idea of what our 468,000 women may be like. Let's look at a snapshot of HIV incidence among women in 2014. According to the CDC in 2014, women made up 19% of the estimated new HIV diagnoses in the United States. Among all women diagnosed in HIV in 2014, almost 80% were women of color. Also, research released by the Positive Women's Network earlier this month found a few key things about women living with HIV. One, that women living with HIV are living in extreme poverty. 89% of the women surveyed were living in poverty at the time. 17% of their respondents had been diagnosed with PTSD, and an alarming 64% had been diagnosed with depression. 61% of U.S. women living with HIV have experienced lifetime sexual assault, and what's key here is that that is 5 times the rate among the general population. Lastly, I want to highlight that 55% of women living with HIV have experienced intimate partner violence, which is almost twice the rate reported in a national sample of women. So here we are. Given everything we've heard so far, we put together this panel of PrEP for Women pioneers. This is a group of innovative PrEP implementers. Their presentation and this discussion can help us all learn from the successes and challenges of screening and offering PrEP to women in the United States so that these efforts may be scaled. What I'd like to do now is turn over to Dr. Nika Seidman to talk to us about her experience offering PrEP to women in the family planning setting. Nika, welcome, and thank you for being here. Nika, we don't hear you.
Can you hear me? We don't hear you. Now?
Yes, we do.
Yes, we do. Excellent. Sorry about that. Thank you so much, Yamini. And I wanted to, before I got started, to really thank everyone else on the panel. It's a true honor to be on a panel with such amazing people who are right out on the forefront, thinking about implementation and thinking about how to put our research and words into action. It's my favorite type of panel I think I could ever be on. As Yamini mentioned, I am a family planning provider, and when I saw the statistics that Dr. Don Smith put out around the number of women in the U.S. who are eligible for PrEP, my first question was, who in our healthcare system, and I think this is kind of just rephrasing what Yamini said, who in our healthcare system is going to take responsibility for offering those women PrEP? Who's going to reach them? And who is going to help women go through risks and benefits in a safe and careful way to really, and I'm going to emphasize the word offer PrEP, not recommend it, not make judgments and say you must have this or just write a prescription, but who's going to go through in detail women's vulnerabilities and help women weigh their choices in terms of what is the best HIV prevention option for them. And again, as a family planning provider, my kind of professional training is in the realm of reproductive health. I'm an obstetrician gynecologist, and I thought back on the training that I had around HIV prevention strategies and really realized that it was pretty minimal. Our training really focuses on reproductive health care, and we do a lot of sexually transmitted infection testing, but not necessarily good training on counseling around prevention, different ways of providing sexually transmitted infection prevention, and certainly not any specifics around HIV prevention services. And so when PrEP came out, I really felt poorly equipped to, at least from my training in obstetrics and gynecology and family planning, to talk about that with my patients. And that made me start to think about what is our role as family planning providers in terms of offering PrEP? Do we have the skills to do so? And then, is it our responsibility? And I think the question really has two parts. One, what do providers feel like is their professional responsibility and what's within their scope of practice? And then the other part of that question is, what do women want? Where are they presenting to care? What are their expectations from a visit? And I think what's so important about Dr. Judy Auerbach's paper is it really implies that women, when they go to a reproductive health specialist, expect to receive comprehensive and integrated sexual and reproductive health care. And so the next question is, so are we providing that, and are we equipped to provide that? So with those kind of key questions in mind, I worked with Shannon Weber, who's here, and the Office of Population Affairs to do a survey of family planning providers in 2014 to 2015. And it was a national survey. It was an online survey, a really quick, anonymous 30-question survey. Quick and dirty, I think, is the best way to summarize it. But what we really wanted to know are, what are providers' knowledge of PrEP? And starting to get at some of the questions are also, what are their attitudes towards providing PrEP? And what we found in the paper, if you want to know the details, is published in Contraception just recently. But what we found was among approximately 350 providers, the majority of whom were nurse practitioners, less than half could define what PrEP was. Less than half could state what the efficacy of what PrEP was. And less than half, when we're faced with a clinical scenario of someone who had had a recent condomless sexual exposure, could order the correct HIV test to diagnose them if they had acute infection. Moreover, only about 30% had even seen PrEP guidelines. So it wasn't like people had had some education and it wasn't kind of hitting home. It was more that people hadn't even really been exposed to this new HIV prevention option for women. And that seemed like a really important gap in our training to try and address. I think the other big takeaway from that study is that we learned that the vast majority of providers, almost 90%, really wanted to learn more about PrEP and were enthusiastic about getting more training. There were some remaining questions that kind of led to whether providers felt like PrEP provision and education was in their scope of practice. And based on those questions, we then proceeded to do a couple of focus groups. We've done 6 to date. And what we've found from those focus groups with providers that there certainly are important barriers to PrEP provision. Big barriers include providers' time, providers feeling like we need a clear and easy set of guidelines to follow or a protocol to follow to screen women. And screening women is really complicated. Providers really get that these are nuanced conversations that take time and energy that may not fit into a 15-minute visit. But the flip side of that is that providers have been really clear that they know that more than half of women in the U.S. only access healthcare through their reproductive healthcare provider or their family planning provider. So if not us, who else? And really importantly, this is an access issue. And then finally, I've done a number of trainings now with in particular Planned Parenthoods in California. And what we've talked about is that HIV prevention really can't be separated from reproductive intentions, because when one of your previously main strategies to prevent HIV was condoms, if someone wants to have a baby, it's really important to talk through a variety of options. And so reproductive intentions and HIV prevention strategies really have to go hand in hand. And family planning providers are having those conversations about reproductive intentions every day. We are already taking sexual histories, and while we may not be perfect at it, we are embarking on those conversations and developing trust with our patients. And so there really is a really perfect segue to launch into those conversations. And so from the focus groups, we're still analyzing those data. We really have been seeing the tension between, yes, there's time constraints, yes, there's barriers in terms of education, yes, family planning providers need more training and need more time, but there's also this kind of feeling of professional responsibility and feeling like these services just make sense to provide together. And I think we'll learn more about that as we learn more, really importantly, and do more research on where women want to learn about PrEP, who they want to learn about it from, and in what kind of context. But I think, as I said, Dr. Auerbach's paper has really fueled the fire, and I think we have a lot of work to do in the family planning world, in particular around education. So I'll wrap up by just saying we're trying to start with doing more trainings. Again, I've been working with Planned Parenthoods in California, and many Planned Parenthoods around the country are starting to do trainings around PrEP, which is really exciting. But this is obviously not just a Planned Parenthood issue. There are many family planning providers in many different arenas of the country, and it's important to figure out how to reach them. We've been working with the National Training Center for Family Planning Care around doing some online trainings, and at some of the national meetings for family planning providers in the next year, PrEP is starting to kind of creep into the agenda, which is incredibly exciting. And so once we really increase our training and improve our knowledge, then the next steps will get down to the nitty-gritty of how to implement. And I think there are some really critical questions there that we'll have to learn about in the next few years. So thank you.
Thank you, Nika. That was extremely inspiring, and thank you for working with family planning providers on identifying barriers, the time issues, the training issues, and thank you for really saying that at the heart of it, people believe that they have a professional responsibility towards their patients, and that it just makes sense because half of the women in this country get their care from family planning providers, and that's really, really important. And thank you so much for the work that you do. Let's move on and hear from Caitlin about how PrEP is being provided in the federally qualified health care setting and what it looks like there.
Hi, thank you so much, and thank you for hosting, and thank you so much, Nika, for your comments. Yeah, so I really want to just echo one of the things that you said, and echo that it's about offering PrEP, right? And I think that that's huge, and kind of where I'm going to kick off and talk a little bit about the setting that I work in and that we offer PrEP. And so we're a federally qualified health center here in Philadelphia, Philadelphia FITE, and we offer PrEP at our health centers. So we have 2 health centers that see both young people and then anyone seeking primary care. And that's in a setting that offers full primary care and sexual and reproductive health care. And one of the things that we've really seen, particularly with offering PrEP, and offering PrEP specifically to our patients that identify as women, is that it's about offering PrEP, right? And it's about offering PrEP continually over the span of their visits, and that it might not be the first visit that they're interested in initiating PrEP or getting that prescription, but that perhaps on the third visit, that the rapport has been built with their provider over time. They're really interested in uptaking PrEP. And I think that that is the key, that, spoiler alert, if you're going to take one thing away, is that it's about continued conversations. And I think one of the things that we've seen is that's not unique, right? That's a thing that we see with talking about IUDs. That's a thing that we see with talking about maybe changing methods when we're looking at birth control, that it's about continued conversations and building trust with providers, particularly when it's looking at a new method or looking at something that might be new for someone in the healthcare setting, that it's about trust and it's about really building that relationship with a provider or someone in the office, right? It may not actually be the medical provider. It's really about a team approach, and that's something that we feel really strongly about. So the medical assistants in our office talk about PrEP. It's about scope of practice, right? So the medical assistants talk about PrEP and really say that you should really talk with your healthcare provider. PrEP might be a really good option for you. Here are some of the things that we can do to support you. And the counselors talk about PrEP and can really talk about the ways in which medication access can be focused on in our clinic. And I think that one of the things that we've seen is that some of the young men that come into our clinic are really ready to start PrEP immediately, but for our young women, it's visit 4, visit 5 that it takes until they're really ready to initiate PrEP. And I think that what's unique is that you have to get folks to come in for 4 visits, right? Which, when we're talking about time or capacity, that's an issue, right? And so how can you look at how many visits, or how can you structure your time or your clinical capacity to bring folks in? Is it a med check? Is it a pill check for a birth control visit that you can bring folks in for a quick visit to then re-engage folks around PrEP? One of the things that we've also seen really successfully with talking about PrEP in the clinic is that it's every patient, every visit, no matter who it is, and it's not about risk. And that's one of the things that we have seen destigmatize PrEP for every single person. And I don't think that it's actually unique to women. It's unique to just taking risk out of signs in the waiting room, taking risk out of conversation. It's about putting how can PrEP help you have the best sex of your life, and what is that for you? And then really bringing the nuance into the exam room and into a conversation with your provider. And so then it allows folks to feel that PrEP could be the right option for them. It doesn't mean that you need a PrEP prescription, and certainly our providers aren't putting every single patient on PrEP and providing a prescription to every single patient, and I think that's important, right? So it doesn't mean that you need to provide a prescription to every single one of your patients, but one of the things that I think we're really clear about is even if PrEP's not the right option for you, PrEP might be the right option for someone you love. PrEP might be the right option for your partner, your mother, your aunt, your best friend, and so everyone in our community benefits from knowing about PrEP. And so I think even if somebody's not ready to hear for themselves in that moment, it can pique their interest. And then at visit 2, they might say, actually, tell me a little bit more about that PrEP, I'm curious. And I think that one of the things that is really important is that, folks may not think about the sex that they're having as risky, or want to think about their partner as risky, and particularly for women who may not identify themselves or their partner as risky, or the types of sex that they're having as risky. I think, I don't like to talk about sex as risky. I think that it stigmatizes it. I think it really puts barriers up, but I think what we can do is have educated conversations with our patients about how to talk about sex with their partners and talk about sex with the people in their lives, so that they can really become informed, both for themselves and their communities. And I think that's something that, we always see our patients as only patients and not as necessarily educators in their communities. And so I think that's really important, is that maybe you can have a conversation, and it's always, you said something, Nika, where you said we're really good at having these conversations. And so when I talk with providers, they always kind of sometimes say, well, visits are short. And visits are short. Billing is really real. You know, I really want to acknowledge that. But one of the things I say is you're already having this conversation. So this isn't a conversation that you have to change. You're just changing the script a little bit. So you're not adding another conversation, you're just modifying the script, and I think that's really important to acknowledge. And I just got the 1-minute warning. So I think that's one thing that's really important. And the last thing I'll say is when we think about adherence, the one thing I will say is, you know, we have a really intensive adherence support program that brings folks in weekly, bi-weekly, monthly, or every 3 months. But I think when we think about PrEP for women, we're really good at adherence for birth control pills. We have a lot of adherence support and techniques and plans under our belt, and what we can do is we can look at the successes of these and modify them, or look at the challenges or lessons learned from birth control and see what works well in our practices to support our women on birth control, particularly on pills, and utilize those strategies for PrEP, and particularly uptake when we look at how to support our young women on PrEP, and particularly pill adherence. So thanks.
Great, Caitlin, thank you. That was so super grounding. I really appreciate talking about the continued conversation, how sometimes it takes 4 visits, and how we work that into how we work with women and young women. Building trust and building rapport with our patients. The fact that everyone talks about PrEP, from the medical assistant to the counselor to the providers. And then how we tie PrEP to pleasure. We don't just make it about risk. We don't just pathologize it. That we make it about fun and love and pleasure, and how important all of that is. Thank you. That was beautiful. Let's turn over to Tess. Tess, tell us about the groundbreaking work that you're doing at in the South Bronx with providing PrEP in the pregnancy care setting.
Hi. Thank you, Yamini, and thanks to all of you. It's just a total thrill to be here with you. I'm going to start by explaining a little bit where I work. I work in the South Bronx in a zip code that has the highest rates of HIV, hepatitis B and C, and STDs in the city. Our prevalence rate runs between 2 and 3%, depending on the zip code. And at any given moment, we have between 15 and 20 pregnant women positive pregnant women in our care. So we pretty much have a lot of experience with HIV and pregnancy. I'm going to review the cases which really drive me very, very briefly. In 2012, we had a teenager come onto the labor floor, perfect prenatal records in hand, negative at the beginning of the pregnancy, negative at the end of the pregnancy, vaginal delivery, breastfed, went home, and 2 weeks later we got a call from the state that the newborn screen was positive. The baby was thankfully negative, but at that point we realized, she disclosed that she had known all along that her partner was infected. No one had ever asked her, and she had never told. So we decided we needed to ask. With a seroprevalence rate of 3%, you know, women are really meaningfully at risk. And so we added at that point the question, what is your partner's HIV status, both to our antenatal history section and to the labor and delivery admission form. We got fair uptake in the outpatient setting and almost none in the labor and delivery setting. In 2013, a woman came in 30 weeks pregnant, febrile, ruptured membranes, positive screen for drugs, hepatitis C, and no one asked her about her partner's HIV status or risk. She had 2 also negative HIV tests in hand, one from less than 2 weeks prior to the day she presented. And that baby was delivered, admitted to the NICU, and had 3 negative newborn screen tests, which were sent as part of routine metabolic screens. The 4th, on day 65 of life, came back positive. and we were called by the Department of Health saying it's a specimen mix-up. It wasn't. That newborn screen, that antibody showing up in the newborn screen was the baby's own antibody. And in retrospect, it was really clear that that mother had presented in acute seroconversion, and that baby is infected. So we really became refocused on screening because, you know, we can't rewrite history. We don't know what anyone would have said if asked, but we do know we can, moving forward, ask aggressively. So we really began a campaign of educating providers to ask the question, what is your partner's HIV status, with the choices positive, negative, I don't know. Again, in the antepartum and in the GYN setting, we negative gets, well, he should test again. I don't know gets, well, he should test with testing information. And positive gets the appropriate screening, an antibody test, a viral load, and a chemistry. And a referral to meet with our community education assistants who help us, who do the majority of the HIV risk assessment and counseling in the outpatient GYN setting. And they then transition those women to the HIV clinic, where really experienced providers will evaluate whether PrEP is right or not. We currently have 5 pregnant women on PrEP. 2 of them are repeat pregnancies. The 3 others came to us from the outpatient clinic, having been asked as just routine questioning. You know, do you have herpes? Does your partner have herpes? Does your partner have? Do you know your partner's HIV status? We have the tremendous good fortune of having those community educators right there in clinic who are very skilled, having transitioned positive women for many years, to understanding this risk and transitioning those folks to the ID clinic. I realize the ID clinic is technically not the ideal setting, but for us, the loaded term at this time is getting the women into the proper care. The OB HIV providers are enthusiastic and comfortable. The ID providers are enthusiastic and comfortable. The generalists are less comfortable. We would like them to increasingly become comfortable, but for now we're working on getting those women in care, and not everyone has accepted the medication, but we've been able to engage partners, verify that they're in care, get them back on PrEP if they've, or on ART if they've fallen off, verified what their viral loads were, really be able to assess risk as the woman goes into labor and delivery. We've also, recognizing that the city's Department of Health program is really focused on educating the MSM community and the providers who care for MSMs, we reached out to them saying, we need your help with women. And you need our help with women. Let's work together on building a woman-centered curriculum. And I was really glad to hear about medical assistance from Caitlin, because our next step is to engage the medical assistants and having them ask, when was your last HIV test? Do you know your partner's status? And so that we're really both expanding the pool of knowledge among all the caregivers, that it doesn't just belong to the medical provider. It belongs to everybody, but also having the women really not missing the opportunity to ask the question. There are still a lot of barriers. People talk about time. People talk about feeling the question is itself stigmatizing. People, aren't always comfortable. But it's really a work in progress. The biggest thing, and I think probably the most important thing, is that we've built these questions into our EMR, that our hospital leadership is supportive, and they're now built in to the GYN templates, the OB templates, and we're working on building it into the basic screen. So I think that's been our biggest step, and will be our biggest tool going forward. So thanks.
Tess, thank you so much. You really are doing the work on the ground. Thank you for talking us through what it means to get some system change, the nuts and bolts of it, the changing the EMR. I'm really inspired that you have worked with the health department, because PrEP messaging is very MSM focused, and we need them and they need us, and we need to work together to get...
Yeah, they were incredibly receptive, and are coming in to do trainings with our staff. So we're very, very excited.
And thank you for bringing it back to also what Caitlin said earlier, which was getting everyone on board, getting all caregivers on board, not just providers, and that this is a change from the bottom up, and that we begin implementation as a team. Great. Let's go to Sammy. Sammy, hi, welcome. Thank you for being here, and tell us about the work that you've done, PrEP in the family medicine setting, and the primary care provider survey.
Thanks, Yamini. Thank you for having me. This is a great conversation we're having already. So as a little background from my perspective, I am currently a chief resident in a family and community medicine program in San Francisco. We serve primarily an urban underserved population. We also have a very small HIV clinic that's sort of embedded in our family health center, where we have primary care providers who are actually doing HIV care. And I think because of that, really had natural champions for PrEP in a setting where we already have a lot of providers who are really excited about thinking of PrEP as a reproductive justice issue and a social justice issue that they want to take the lead on. So that's been a really exciting setting to start doing PrEP work in. The other part of what I do with PrEP is actually doing some provider trainings and clinic capacity building for clinics interested in integrating PrEP services. We've mainly been focusing on primary care clinics and reproductive health clinics to really ramp up their PrEP services. We recently did a survey of primary care providers in the East Bay, so kind of Oakland area and the surrounding area, and got some good information about their interest in PrEP. What we didn't get a lot of information on was specifically how they envision providing PrEP to women. I think we've recognized that as a gaping hole in all of the literature, and even in what we need to know on a local level about reaching out to our women at risk of HIV. And we are actually in the process of starting a research study at one of our local community health centers that's going to do some more focus groups with women to try to identify better ways for them to access PrEP and for us to present PrEP as an option for them. But in terms of primary care providers themselves and the idea of PrEP, what we have found is that PCPs have really embraced PrEP as being something that's part of the services that they provide. A lot of PCPs at this point are usually only seeing a handful of PrEP patients, so anywhere from 1 to 5 patients on PrEP. And this seems to be the pattern that we expect, that any PCP who's offering PrEP might only have a small handful of patients, but they really end up self-identifying within their clinical setting as sort of a PrEP champion, usually because they have some experience in either HIV or in reproductive health, where it does start to feel pretty natural to include PrEP services. And they're the ones who are really reminding the clinicians they work with that we have PrEP, when helping clinicians to identify their own patients on PrEP, and then either doing sort of an internal referral for PrEP services or helping their colleagues start and manage PrEP. alongside them. So that's been really great. I think there are a lot of things that make family medicine visits really ideal for offering PrEP services, and I think two big opportunities that we're realizing we can take more advantage of are, number one, patients establishing care. With the Affordable Care Act, there are more patients than ever who can finally access care, afford health care, and a lot of times they come into their initial visit saying, I just know I need a doctor, and I wanted to make sure that I have one, and I don't really have anything on my agenda. And so that's a prime opportunity to actually do a really thorough social and sexual history and really do some counseling around what we have to offer in terms of HIV prevention services and PrEP. I also think that the adolescent encounters we have are another great opportunity. In our family medicine clinic, we often have young adolescent children of our patients, and we really get the opportunity to do best practices and have the parents step out of the room and teach our youth about confidential, sensitive services, how they work, do our sexual health screening, and also really integrate PrEP into a general message of reproductive health, of STI prevention, HIV prevention, and pregnancy prevention all in one. So it's not something that we first identify risk, but really every adolescent should know this, as we know that they are kind of entering their sexual debut. We also know that most adolescents are getting their health information and medical information from one another. And so, as Caitlin was saying, even if they don't seem like the PrEP candidate themselves, they're certainly telling their friends about PrEP out in the community and are probably going to be the way that the word gets spread about PrEP among youth. Couple other things about being a family medicine provider doing PrEP services, which I love, is one thing is that we have relationships, and we really rely on long-term relationships being central to what we offer as primary care providers. So we really are well equipped to have these ongoing conversations that we often need to have to introduce the idea of PrEP, to talk about risk, to come back to someone's sexual history after we've taken it for the first time, meeting them a couple years ago, and reassess what has changed and what else we need to consider in terms of their reproductive and sexual health. And another great thing is that we actually have that broader clinical context. And what I mean by that is that not every PrEP candidate is going to be a young, healthy, reproductive age person. Some people do come with comorbidities, and I had a great reminder of that myself in clinic about a month ago, where there was a woman in her late 30s who I was seeing for a colleague on vacation. She had really complex autoimmune disease, pulmonary hypertension, was taking methotrexate, and I was just kind of trying to get my head around the basics. And at the very end of the visit, she asked me for an HIV test, completely out of the blue, but it opened up a beautiful opportunity to really talk about what prompted her to want that test. And she ended up revealing that she had had a couple partners with whom she didn't feel comfortable asking about HIV status. She didn't feel comfortable asking about whether they were monogamous in their sexual relationship. And I hesitated for a second about bringing up PrEP because she was so complicated that I almost got nervous about the idea of throwing Truvada into the mix. And then I had to really remind myself that the greatest risk to her health with her comorbidities is getting HIV. And if we have those tools, then we at least need to start the conversation about how those tools might fit into her life. So I think we have that opportunity to really help patients who aren't the traditional patients coming in to our reproductive health settings to manage PrEP in the context of complex illness, which really probably won't be that hard, but can be intimidating as a provider with our 15-minute visits. So I think that is what I'm most excited about, and really just that I think family medicine providers really do embrace the concept of PrEP in the context of reproductive justice and social justice for these patients. So that's a really exciting angle for us to continue to work on.
Thank you, Sammy. So excited to hear about putting PrEP in the context of reproductive justice and social justice, and thank you for talking about how family medicine is really in the right position for this, and how those are long-term relationships, and how you have sort of the luxury of coming back to this conversation maybe a year or two later with patients. And also thank you for talking about adolescence and how they get their information from each other, and that's, you know, that's how kind of we all work in all age groups, right? And so gatekeepers are so important, or spark plugs, as Anna Forbes likes to call us or them. Thank you all. We will now head into a question and answer session and begin to answer the questions that are lining up here, as well as ones that we were sent ahead of time. I will turn over to Amanda and Shannon to take on that. I'd like to remind everyone that this conversation is also going on in a parallel sphere on Twitter using the hashtag Where's My Prep. So join us on there as well. Amanda, take it away.
Thank you, and thank you to all the panelists. It's really interesting to hear about PrEP in your different settings. We have a question about trans men. Oftentimes they might be included in the total numbers of heterosexual women who might benefit from PrEP, but trans people are not included in, or they're not listed in the CDC numbers specifically. So we're wondering, do any of the panelists have experiences to share about the inclusion of people who have uteruses or vaginas who don't identify as women?
I can start the conversation on that piece. First of all, to whoever asked that question, thank you. Such an important topic to address. And I would start by saying that we really need more research on trans men, and including trans men in this conversation is critical. And we need to learn from trans men in order to know vulnerabilities to HIV and how we can best serve them. I see trans men in mostly two settings, occasionally three. The first setting is in the context of gynecology clinic, trans men who desire surgery, for example, removal of a uterus. As a gynecologist, we perform those services, and I find that as a really valuable opportunity to talk about sexual health. And in that setting, we offer HIV testing and a conversation about PrEP. I think it is a really big challenge, and we as gynecologists are really working on learning about how to best provide services to trans men so they feel comfortable in gynecology clinics, which traditionally feel like they're targeting only women. And so we really have a lot to learn from the trans population about how we can make our clinics more welcoming and building that trusting relationship. I think one of the really key themes throughout this entire conversation was building trust with providers in order to have frank conversations where we educate about PrEP, offer PrEP, and talk not like Caitlin said about risk, but about vulnerabilities and about ways to optimize our sexual health and sexual experiences. And so, as again, our gynecology clinics have a lot of room to improve in terms of welcoming trans men. The other setting in which I have seen several trans men and talked a little bit about PrEP has been in the not necessarily contraception side of family planning, but in the abortion side, in trans men who haven't been offered reproductive services, who don't desire pregnancy, and who had an unintended pregnancy and want an abortion. And in that setting, I think, again, it's a critical opportunity to reach patients who may not be accessing the healthcare system in other settings. I think the last place where we really, really, really need to work on is making sure that we don't make assumptions about trans men's reproductive intentions and ask them about their pregnancy intentions. We have had a couple, not many, but a handful of trans men who have continued their pregnancies, the desired pregnancy. And again, the pregnancy setting continues to be a place to offer PrEP. But again, in all of those settings, we really need to think about how we can expand our concept of what we traditionally think of as women's health services to invite and feel welcoming to all people so that we can offer PrEP in a safe and welcoming setting.
Great, thank you so much, Nika. So I want to answer one of the questions that has come in. Will the resources and links be available? Yes, Yamini has a slide at the end, and we'll put other resources that are listed in the links in the YouTube video. Thank you for that question. I want to thank Poppy Morgan for womaning the HIVE Twitter account today, where we have lots of friends on Twitter and some of the questions coming in. I'm going to bunch two of the questions that have come in here through the Hangout together, and then it will be the last time in this Hangout that we talk about PrEP in the setting of pregnancy, because we're looking to move beyond that. But two really great questions have come in. One, Margaret Lampy has asked, are any of the speakers involved with couples partners testing in the prenatal care setting? So I would expand that. If I don't know, Sammy, if you guys are already doing couple partner testing outside of the prenatal care setting, but it's something that Margaret and her colleagues are looking at in the prenatal care setting as a way to screen. And going with that, how there's a question that's come in about how the women's partners are involved during pregnancy with her decision to take PrEP. So Tess, let me start with you on that, and then Nika, if you have anything to add after Tess finishes.
So I'm going to actually ask you to repeat the second question because
how
it got a little garbled.
Yeah, how are partners of pregnant women involved in her decision to access PrEP? Can you not hear me?
Okay, I didn't hear it again, but I'm going to go with the first question.
Good.
We do not do couples testing, but we offer information and free testing for all male partners. And women can bring their partners in. In the setting of positive women, we really actively encourage partners to come in, and we are now speaking with all of our positive patients about their partners, encouraging them to talk to their partners about PrEP if the partner is known or believed. I actually think that one of the really interesting things about PrEP is that it hi. Sorry. So, and do you want to try again the second question?
Let me go to Nika, actually. So, Nika, do you want to try and hit that? Do you have any experience with couples testing in the prenatal care setting? And then would you like to address how partners are involved when a pregnant woman's access to PrEP?
Sure. So I'd agree with Tess that most of our experience comes from women living with HIV and then offering partner testing through that setting, and we have a lot to learn, I think, from that experience. I think that we have we do not have a consistent way of offering partners testing through women who we're offering PrEP to, and I think Margaret Lampy asked that question. I think it's a phenomenal question, and we need to work more on that. I actually believe there's a clinic in Chicago who is working on getting in HIV tests to offering women who are pregnant HIV tests for their partner, which I think is a really interesting and novel way of thinking about helping reach those men who often aren't accessing the healthcare system at all. In terms of partner involvement in PrEP, I think it is 100% dependent on the conversation with the woman, and it can go in many, many, many different directions. But oftentimes, and I found particularly around pregnancy, offering PrEP in pregnancy has been an opportunity to not only have the partner come into prenatal care, but also ask for a release of information, to be in touch with his doctor or healthcare provider, to find out about how his viral load is doing, how is his adherence going, and really help re-engage him in care in some really powerful and exciting ways. I think pregnancy in some ways makes that easier because there is this kind of history of couples going to prenatal care together, and how we extend that approach to wellness outside of the pregnancy setting is a challenge and something we need to learn more about and practice more.
Great. Thank you for that. I'm going to now gear these next questions towards Caitlin and to Sammy. I'm going to bunch two questions together, one from Jessica Tarleton and another from David English. They're asking about phrasing and these terms, high-risk sexual behavior, at risk. I also want to throw in, and Yamini, I really struggle with, is how often we talk about these women as if they are not us. But how is it that this phrasing can be stigmatizing to women, and what can we do differently that's inclusive, particularly in a primary care or family planning setting, that allows us to screen women or engage with women beyond just their partner's status? Caitlin or Sammy? Okay, Caitlin, we can't hear you. You want to unmute?
Great. Sorry about that. So I think, you know, when it's comes down to it, one of the unique ways that I get to kind of talk with folks in our clinical setting and in our programs, and I think, you know, I think and I think this extends into our program, is that when we talk about, is there still that feedback? No. Okay. When we talk about high-risk sexual behavior, when we talk about, you know, these things, I think what it does is it really creates an us-them dynamic, right? And I think that one of the things that does is creates a sense of dichotomy, right? And I think one of the things that we do, you know, particularly the setting that we have most of our folks prescribed PrEP is in a youth clinic, right? So most of the folks are under 25. So the us-them dynamic doesn't actually do very well. And so I think that what it's about is creating a sense of a team. You know, we're in this together. We want you to live your best life. Like, what is that? And so it's about us helping you have the best sex that you can have. Tell me about that. Yeah, I'm like a lady sitting here who's asking you to have a conversation with you about sex. Somebody may not have asked you to do that before, so that might be a little weird. Let's talk about it. And I think one of the things that's important is to acknowledge the fact that sex should be pleasurable. Young people have the right to pleasurable sex. Young people have the right to a provider that's going to ask them about having pleasurable sex. If your provider hasn't asked you how they can help you have better sex and how that can be safe and how that can be pleasurable, then you should look for a new provider. And you have the right to do that. And I think that's one of the things that I think that's really central to this conversation about PrEP. You shouldn't have to jump through hoops to have a provider provide you a prescription to PrEP. You shouldn't have to jump through hoops to have a provider help you have conversations about sex that feels safe and sex that feels good and sex that feels like pleasurable, and that you're like having that you are having those conversations with your provider. And I think that when you start and you lead conversations about, like, do you have vaginal, anal, or oral sex? You know, like, that's not the conversations that I have with people that I talk about sex with, right? So if that's not the conversation I want to have about sex, then that's not the conversation that I want to have with a young person about sex. And if that is, you know, I think that's really important, right? And so the other thing is when we say, like, tell me about your risks for sex, if a young person doesn't actually think they're at risk, the conversation's done. And so if you say, like, tell me about the sex you're having, tell me about the cute people you're having sex with, that's a conversation. And then we can say, okay, cool, like, tell me about that person. I'd love to hear more about them. And then you get into a conversation, because actually I care about the people that my young folks are having sex with. Not in a way that I want to know what is risky and what is not, is because I care about the young people I work with, and therefore I care about who they're having sex with, both on a level that fundamentally is somewhat about risk, right? But more about, I want to know, like, are they having pleasurable sex? Are they feeling fulfilled as young people? And, like, is PrEP a good option for them? And how can I support them around taking it every day, right? And I think that is really at the crux of it. And I think if we can't circle back to, like, can we talk about are our young people having orgasms and feeling safe in their sexual relationships, then maybe we should reconsider, like, quite frankly, like, are we the right people to be having those conversations? And that's a really, like, you know, not to sound like a little bit militant, but it's a really serious question to ask yourself. Like, if you can't handle talking to young people about, like, pleasure and intimacy and potentially hearing about all the real and raw ways in which they're having sex, and potentially hearing that, like, PrEP is a great option for them because right now, actually, condoms aren't, then that's really important, you know?
Great.
Yeah.
Thank you, Caitlin. We have to wrap up, Yamini says.
We have one more question, actually, from Joey, who wants to know regarding positive men who have sex with cisgender women and ways to engage those patients in talking with their partner about PrEP. Does anyone have experience with that? Maybe Tess or Nika?
So anybody have experience with men living with HIV and doing outreach to their female partners about PrEP?
Well, some of our women have been brought by their partner. And, you know, I think that it's also a question of training HIV providers men to ask about their reproductive questions and to ask, you know, to really, do they know their partner? I think it's, you know, time pressure is the enemy of all of this. It's really easy to say, are you using condoms? Yes, good, okay. And in fact, there's a lot more to know.
This is Nika. I completely agree with Tess. I think it's an opportunity that we need to take advantage of more. Really asking men about who are their partners, inviting them to visits, using this as another opportunity to invite women into the conversation. And I think what's so exciting about this panel is that we really need a diversified approach to reach these women, these over 400,000 women, and this is one important way that we can work on. First of all, through educating providers, and like Caitlin and Sammy and Yamini said, like, providers throughout the spectrum, from the medical assistant to the counselor to the provider, and asking them at different points and in different ways, because different patients are going to respond to those ways differently. And then similarly, in asking them about their partners and inviting those women in, it'll be a powerful way to reach women.
Thank you all so much. That question and answer session was riveting, to say the least. We have many more questions that we were not able to. And like I said before, we'll go ahead and answer those in the comment section. Sorry about this echo. I'm not sure why it's happening. I will hand over to Shannon, who's going to tell us a couple things. One, things that are going on around this country involving women and PrEP right now, and resources that you can access. There's also going to be a slide put up which is going to have a link to most of these resources, and those will be clickable when I send this video out tomorrow. So I'll turn over to Shannon.
Really quickly, want to thank everyone for joining. There were so many awesome questions which can help us inform the next Hangout. Yamini will send out a survey afterwards, so don't hesitate to offer suggestions. If you yourself are able to present on a future Hangout about work you're doing, we would love to highlight that. And if you have questions, make them as specific as possible, which can help inform the dialogue for the next Hangout. We will make sure that these following resources are available to you, but want to shout out the U.S. Women in PrEP Working Group, which you can find on Facebook. They do several webinars a year, which really lay the groundwork for the clinical and upcoming research around women in PrEP, and they've been the longtime advocates for women's access to PrEP here in the U.S. The Black Women's Health Initiative just launched their PrEP for Women campaign, which you can find online. PleasePrepMe.org is a location-responsive California PrEP provider directory, and we have on there many providers who offer PrEP to women. If you're a California provider, please add yourself. There's also a parallel conversation going on globally about women in PrEP, and if you go to the HIVE website, we have a global share, which is the Global Community for Sex, HIV, and Reproductive Empowerment. We have Hangouts and tools that we're creating there as well. On our website, we have a PrEP pocket card for primary care providers and a whole suite of resources for women and their male partners around PrEP, particularly around reproductive health. And these include videos and printables. And coming in the next week, we'll have a video series that we created in collaboration with AIDS Foundation Chicago, featuring 8 different vignettes of providers and patients talking about reproductive health, including PrEP. And the PAETC, Sammy's group, has an awesome clinical PrEP primer, 3 pages, everything you need to know about how to inclusively offer PrEP in a primary care setting. And upcoming, we have 3 new Hangouts, one about frameworks for getting to zero, one about youth in PrEP, which I expect many people on this Hangout will be interested, and also we're going to do a shorter Hangout, a coffee chat with Dr. Angela Kashuba and Dr. Mackenzie Cottrell about pharmacokinetics and reaching protective levels in the vagina and the rectum, and how that's different for men and women.
Thank you, Shannon. From the bottom of my heart, I want to thank Amanda, Nika, Caitlin, Sammy, Shannon, and Tess. This was very enjoyable, putting this together with you all, being here with you all, and I'm sure moving forward, everyone that joined and didn't join has a lot to learn and share with us as we move forward in providing PrEP for women, for us, for our sisters, for our daughters, for our mothers. And I'm really thankful to be able to do this work with you. Thank you all. I'm going to put up a slide now, which is going to have most of what Shannon talked about. Everything else is going to be in an email to you all. Thanks a lot, and have a great day ahead of you.
Thank you.